Texas.
Welcome back at the bottom of the hour. Here's the statistic. 60% of men avoid seeing a doctor even if they're sick, even if they think there's something wrong. So here we go. June is Men's Health Month. American Family Care doctors are telling guys, man up, get a physical, even perform some home health checks as well. Dr. Herman Grewal is here to show me and you 5 simple things we can do on ourselves and give us a sense of where we're going. We're not doctors in ourselves, but
Sure.
we can get some clues, right?
Right.
What are we talking about?
So first thing you do is check your own pulse. So if you take 2 fingers and put it on your wrist right about there where your watch would be, you can count for 6 seconds and multiply by 10.
See, I usually go 15 and I go...
You can go 15 and multiply by 4. You just want to get the count for the full minute. As long as you're between 60 and 90, maybe up to 100 if you're worked up.
I typically between 58 and 60.
That's pretty good, yeah.
When I start. So.
Another thing you can do is do a blood pressure check at home. And these are nice, efficient models that check the blood pressure at the wrist. So why don't we check yours if you have a second
Hit me.
here.
You made me remove my watch.
Yeah.
Yeah.
You want that out of the way.
Yep.
And I'm just going to have you hold your arm like that so we can take a look. You can put it across your chest there.
Put it up like this.
It'll be a secret number for the audience.
Okay.
And, you know, we want to see a blood pressure that's around 120 over 80. Definitely if you cross 140 over 90, we're talking about something called hypertension. So you can do this check twice a day, in the morning when you wake up and in the evening at night, maybe a week or 2 before you see your doctor for a workup or at AFC Urgent Care.
And now while we're waiting for the figure to come here, waist measurements.
Waist measurements are...
can tell you a lot.
Oh, yeah. So if you already know your waist size because of the pants you buy, if you're above a size 36 in men's or just a waist circumference of 36 or higher, that's a lot of guys out there. So that puts you at higher risk for heart disease, diabetes, and other health complications.
And it has released my...
Let's take a look and see. Not bad. Under the 140 over 90, but I think you worked up seeing me.
That's extra high for me.
Yeah. So, you know, these are just indications to go and see your physician. I try to tell my patients that, you know, if you can see your physician for an annual checkup in your birthday month, about 1 or 2 weeks after you have your cake and ice cream, it's a good time to remember to get in.
Okay, here's the part that gets guys scared, I think.
Okay.
The issue of testicular cancer.
Sure.
You gotta check yourself.
That's true. So a good time
Don't be ashamed to check.
Don't be ashamed to check, and don't be ashamed to discuss either. So if you have a check every so often, once a month, and just after you shower and you're relaxed, if you find something you're concerned about or you're not sure if it's anything, go and talk to your regular doctor, and if any further testing is needed, we'll get it done.
And I've seen examples, the kinds of things that you should be concerned about.
Sure.
It's like the size of a pea or maybe even smaller than that. If you
anything that's a change in the contour, the density, the shape, if it's painful or not, especially if you have symptoms because of it, changes in, you know, flow or function. Now,
there's also this issue of running our finger inside our mouth. What are we looking for?
Sure, that's an oral cancer check, especially for patients who use tobacco, whether it's through smoking or chewing tobacco. Even if you don't, you should check along your gums once a month, maybe after you brush your teeth, and see if there's any lumps or bumps. And your dentist is a great tool to help you check it out. April was actually oral cancer check month, and some clinics will do that for free.
So when you come across a guy who maybe hasn't come in and done this sort of thing in a while, what words of encouragement do you use other than, dude, you can die if you don't do this, to encourage them to take this seriously?
Sure.
Women take it seriously very regularly.
Right. Well, I try to tell patients who are trying to set the reset button on their health that, you know, anytime's a good time to get started. Don't worry about what's happened in the past. Let's get started with where you're at now. And if everything comes clean and clear, you don't have to see me for a whole year.
Boom.
Yeah, that's
Doc,
it.
Thanks very much.
Thanks,
I appreciate it. It's great advice.
Good to see you.
It's this month, guys. Go and do it. Rita?